Now we will move on to the next second major type of autoimmune disorder, which is called a systemic autoimmune disorder. Earlier, we had seen the different examples for organ-specific autoimmune disorder where cellular damage will take place. Here, it is called a systemic autoimmune disorder because this autoimmune disorder causes damage in different parts of the body involving different types of cells. Since it is going to be distributed all across the body, it is called a systemic. First, we'll take the example of systemic lupus erythematosus. The lupus erythematosus word has come from the butterfly rash that develops on the face of the person. So I will show two photographs. This is of a person belonging to the black race. Look at this rash which has appeared on the face. Either side, these are considered the wings of the butterfly, and this is the body of the butterfly. Now, if you take a person from white race, you can make out the clear distribution of the rash here. This is the wing and this is the body. So the butterfly rash, which appears as a characteristic feature of systemic lupus erythematosus, therefore it got the name lupus erythematosus. Erythematosus is actually because of erythema, red rash. Okay, which doesn't appear red in the case of the persons who have got dark pigmented skin. It will be appearing like this white patch. Now, what is this disorder? Systemic lupus erythematosus. This disorder is the antibodies to be produced, autoimmune antibodies are going to be produced against the nuclear proteins, nucleic acid proteins like RNA, and nuclear proteins, when I say, it will be DNA associated with proteins, platelets, RBCs, and macrophages, neutrophils. The person would suffer from series of immunodeficiencies because of the destruction of the macrophage, neutrophils, and even platelets. Platelets are responsible for clotting. And the antibodies, they are called as nuclear penetrating antibodies, NPA. Very strange kind of antibodies. They can penetrate to the nucleus and destroy the nucleic acid in the nucleus. And it is all because of the strange epitope expressed. And that epitope has been recognized as a non-self component, and the antibody has been developed. It could be the epitope on the cell surface, like as in the case of neutrophils, macrophages, and platelets, as well as RBCs. Or it could be the nuclear antigen, that is nucleic acid and RNA in the cytoplasm. And predominantly, the antibody that is involved is IgA type in this disorder. The reason being, IgA is the only antibody that can be transported across the cytoplasm without being destroyed by the lysosomal fusion. Even if lysosome fuses with the vesicle that is being formed with IgA antibody entering the cytoplasm, the antibody cannot be destroyed by the lytic enzymes because it has got a secretory chain that I had already explained to you people. The secretory chain gives a protection for this antibody from proteolytic digestion. Therefore, this antibody plays a predominant role in the autoimmune response of systemic lupus erythematosus. It is a debilitating disorder, slow, progressive, and results in destruction of large number of cells in the body, and finally the person may not survive. He will lose large number of cells. Then comes the multiple sclerosis, the second example, multiple sclerosis. This is another type of a debilitating autoimmune disorder concerned with myelin basic protein. Myelin basic protein, MBP. And the myelin basic protein, I had already told you that it is present in the myelin sheath as a basic protein. And the myelin sheath is there on the central nervous system, spinal cord, and the nerves that are supplied to our body. Those are the motor nerves and sensory nerves, which is not under autonomic control. Those are non-autonomic. And these nerves, which do the function as per the command coming from the brain, all are voluntary. Okay, all are voluntary nerves. And those nerves which come under the voluntary system of the central nervous system, which respond to the command delivered by the brain, will be covered by the myelin sheath. So all the desired actions that you do, okay, all controlled by the voluntary system. And imagine the autoantibodies will be produced against the myelin basic protein, and most of the myelin will be lost from these nerves. And as the disease starts in the beginning, the person will feel the sensation of loss of movement, loss of desired movements. He will be unable to move. If he tries to move his leg, he will be unable to move his leg or move his hand. Even it will affect the speech, because speech is not involuntary. You decide to speak and the language comes and you speak, and your tongue will be moving to pronounce the words. The speech is also affected. And the person's speech starts becoming slurring as the myelin sheath starts getting destroyed. Finally, it will happen in such a way that most of the myelin sheath of the voluntary nerves will be lost, because of which the person becomes confined to bed, and he will be dependent on somebody to do all his daily needs. Feeding him also will be required, and the person will find it very difficult to move about, and he'll be totally dependent on somebody for assistance. Only the actions that will be taking place in him will be involuntary, which are autonomic, which are not under his control. And the autonomic nervous system is not covered by myelin sheath. Autonomic nervous system, that is sympathetic parasympathetic nervous system, is non-myelinated. And those actions are, which happens without your knowledge, that is your respiration, heartbeat, peristaltic movement of the intestine, digestion process which is taking place in your gastrointestinal tract, formation of urine, collection of urine, formation of feces, all that will be taking place autonomically, in the sense without your voluntary control. And these autonomic systems will be functioning normally, and the person becomes totally a vegetable. Unfortunate that he will not be able to, or she will not be able to do anything. So totally dependent on somebody for assistance. Then comes another debilitating disorder, comparatively much less debilitating compared to these two for the previous disorders, compared to lupus erythematosus or multiple sclerosis. Rheumatoid arthritis to a great extent can be controlled. And the rheumatoid arthritis is the abnormalities of the joints. The person will have the deformities of the joints because the cartilage of the joint is going to be destroyed, because autoantibodies that are produced will react on the cartilage proteins, and these cartilage proteins will expose the strange epitopes, and two types of antibodies will be in action here. One beginning with IgG, and it may end up with IgM. Both these antibodies are capable of initiating complement mediated lysis, due to which the joints will be worn out and the deformities will be appearing. The fingers will become deformed. This is the arthritis of the hand of the person, where the fingers are becoming deformed. Even the joints will become stiff. The person will find it difficult to bend the joints because the joints have lost the lubrication. Synovial fluid which is there in the joints, which lubricates the cartilage caps, will be also lost. So the rheumatoid factor, that is nothing but the antibodies that get accumulated in the joints, will be responsible for this. And the rheumatoid arthritis is most common among the women. And I have mentioned that the reason for that is because of the estrogen hormone. If the level of the estrogen hormone does not go down once the woman reaches the menopausal age and postmenopause, it would cause inflammatory response in the joints and resulting in joint destruction. In addition, there could be other possibilities like the pathogenic infections, and those pathogens mimic the antigenic epitopes of the cartilage and collagen protein, and because of the collagen and cartilage protein antigenic epitopes are mimicked, the antibodies will act on that and cause this problem. Okay, so these three disorders, which are called as systemic because they cause severe damage to other parts of the body, generalized release of cytokines, inflammatory cytokines, and destruction of large number of cells. Okay, then we will discuss something about HLA haplotypes and autoimmune disorder. This is an unfortunate scenario. A person without the knowledge unfortunately inherits a particular type of HLA haplotype, and on inheriting that particular type of HLA haplotype, the person gets predisposed to autoimmune disorder. Nowadays, it is possible by screening the genome of the person. If it is known that it is running in the family, after screening the genome, one can find out whether the person has inherited that particular haplotype in the childhood itself and can be saved from this and sufferance. Because these HLA haplotypes, when the person inherits, they could predispose the person for autoimmune response of various different types. Just to recall back the MHC gene complex, I had shown you this slide where you know that class 2 MHC has got three different alleles, DP, DQ, DR, and we'll keep coming across these letters DP, DQ, DR in the HLA haplotypes concerned with the autoimmune disorder. Predominantly, you will come across DR haplotype. Similarly, the class 1 MHC has three different alleles A, B, C or BCA, in which you will keep coming across B very often and rarely A, okay, but not C. Okay, so B or A haplotype will keep appearing in the haplotype predisposition to autoimmune disorder that is concerned with class 1 MHC. DR haplotype concerned with class 2 MHC. Sometimes both class 1 and class 2 MHC both will be involved in a person of that particular haplotype, and when both are involved, it is called as mosaic or mosaic. Means two different haplotypes of class 1 and class 2 are involved here in causing autoimmune disorder. So let us see some of the examples. Psoriasis is a skin disorder which appears like skin rash, and I can show you two photographs here. This is the psoriatic skin, and when the psoriatic skin develops glossy white patches on them, it is called as licheniform psoriasis. Licheniform means lichen. Lichen is nothing but it is a symbiotic fungus with alga. The symbiotic fungus and algal growth will be there as licheniform, which will be glossy and appearing on the surface of the skin, which is called as licheniform psoriasis. It is dry, very irritating, itchy, dry skin, and very painful. Why? Because when it appears all over the body, only small patches shown here. Imagine if it appears all over the body. Person will find it difficult to wear the cloth also. Rubbing of cloth over it irritates the person and very painful experience by the person. Most of the time, person is dependent on the painkillers to suppress the pain experience from the skin surface. Okay, psoriasis, very bad disease, appears on the skin. Now, who will inherit that or who will be predisposed? Those haplotypes like HLA, B13, B16, and B17. These are all different alleles of the B group. Okay, and that too class 1 MHC. In case if the person inherits these haplotypes, the person is predisposed to psoriasis. Then HLA-DR4, I had said that DR refers to class 2 MHC. DR4 is the allelic form. They are all multiple alleles. It is a cluster of genes in a particular region. So DR4 will be associated, the child will itself suffer from rheumatoid arthritis. Therefore, it is called a juvenile rheumatoid arthritis. In the young age itself, the child will have arthritic symptoms. Similarly, HLA, DR3 and DR4. Now this DR4 locus is not the same as DR4 locus here. It is a large gene segment. Some region of the gene segment will be involved here, and that will be responsible for causing type 1 diabetes. The person will be predisposed to type 1 diabetes. HLA, DR3, DR4 haplotype. That means this HLA haplotype person will inherit the characteristic in such a way that he will produce the antibody, he or she will produce the antibody responsible for the destruction of beta cells of the pancreatic islets. Same way, HLA-DR53, another allele, he is known to expose or increase frequency of the rheumatoid arthritis in a person by tenfold. Okay. Similarly, there are other genes that are responsible for haplotype related the autoimmune disorder. Once again, HLA-DR3, DR4 causes juvenile diabetes mellitus, means childhood diabetes mellitus, type 1 diabetes mellitus. Now here you see it is a complex like HLA-A1, B8, DR3. This is a mosaic. A and B belong to class 1 MHC and DR3 belongs to class 2 MHC. When these three haplotypes have been inherited by a person, there is a possibility of developing diabetes, myasthenia gravis, and systemic lupus erythematosus. All I've explained to you already. Diabetes is type 1 diabetes. Myasthenia gravis concerned with the inhibition of the acetylcholine receptor by binding to the autoantibodies, and so systemic lupus erythematosus few minutes back I explained to you. HLA-DR2 also is known to cause multiple sclerosis in the person. The sclerosis is because this haplotype mimics the myelin basic protein, and myelin basic protein will be present in the myelin sheath, which will be destroyed in these cases. Okay. For example, once again, another combination of mosaic, that is B8 and DR3, increases or predisposes the person for Graves' disease. I had explained to you about this, which is dealt under stimulatory hypersensitivity. It is also dealt under stimulatory autoimmune response, where the autoantibodies will stimulate the TSH receptor to overproduce the thyroglobulin. And this Graves' disease initially begins with hyperthyroidism, ends with hypothyroidism. And this is a mosaic complex of class 1 and class 2. And this one at the bottom, HLA-DRB1, is not a mosaic. The B1 is the domain or the exon region of the DR, which is having the alleles like these 0, 101, 0, 401, 404, and 1402, predisposes the person for rheumatoid arthritis. All these evidences that have come recently, that is after 2000, and they were not available before 2000 because of Human Genome Project. After Human Genome Project, and then the bioinformatics developed so well, one could probe for these genes using the genetic probes and look for these haplotypes. From that, it has been possible to identify these haplotypes, pinpointing that what type of autoimmune disorders they can cause. Okay. That is as far as HLA haplotypes are concerned. Now let us see whether it is possible to mimic the autoimmune disorder in the laboratory condition using experimental animal models. Yes, it is possible. Whatever happened in the body of the person, and we kept telling that because of the changed epitopes, which are recognized as foreign antigens, and the autoimmune response begins, whether it is possible to induce such type of response. Certain experiments were conducted in the animal models, and it could be proved through the experiments that one can be induced. Means we had talked about the mechanistic aspect and the factors that are responsible for the initiation of the autoimmune response. Remember, all different types of factors like changed epitopes, molecular mimicry, and expression of strange antigen due to the aged cell, and the chemicals that are responsible for bringing about autoimmune response, then the viral mimicking of the molecules, and the hormonal induction of autoimmune response. All that we have discussed under the factors that are responsible for the autoimmune response. Here, that holds good in the experimental animal model, which we can prove it. Say, for example, if you want to induce autoimmune thyroiditis in an animal, say, for example, in a rat or mice, the thyroglobulin of the rat or mice origin is modified in vitro by oxidation or reduction of few of the amino acid groups using chemical treatment, oxidation or reduction of the few amino acid groups. Okay, say for example, you may decarboxylate it or you may deaminate acid in the thyroglobulin, and then chemically modified thyroglobulin if you inject into the rat or mice. The rat or mice will recognize the thyroglobulin as foreign and start producing autoantibodies, which will react with its own thyroid, and the rat or mice will suffer from autoimmune thyroiditis, which will be like Hashimoto's thyroiditis. The inflammatory destruction of the thyroid will take place in the animal. Then, about the autoimmune hemolysis. It is a simple experiment where rat or mice both should be chosen, and both are non-related species. They do not belong to the same genus. They are, of course, rodents, but do not belong to the same species nor the genus. One can inject some amount of blood fat into mice or vice versa. After some time, because you had injected a foreign blood into that animal will develop antibodies against that foreign blood, RBCs. Say, for example, you had injected rat RBC into mice, and the mice will develop antibodies against the RBCs. And after it develops the antibodies against the rat RBCs, after a course of time, sometime latent period, within a 1 month's time or so, the mice will also suffer from autoimmune destruction of its own RBC because of the shared epitopes of the RBC of the rat and the mice. The antigenic domains of the rat RBC and the antigenic domains of the mice RBCs are almost similar, except few carbohydrates. And because of the autoantibody developed against the rat RBC, that fine balance of self-tolerance will be lost and the mice will suffer from autoimmune hemolysis. One can induce arthritis in mice or rat or rabbit by injecting the killed preparation of Mycobacterium tuberculosis. The Mycobacterium tuberculosis is known to produce heat shock protein 60, HSP 60, and had given this example. The people who get infected by tuberculosis bacteria are more prone to develop arthritis. The reason being, the bacteria produces a heat shock protein, and that heat shock protein induces the antibody production, and the antibody produced against that HSP cross reacts with the cartilage, the collagen proteins. By cross reacting with cartilage collagen protein, it will destroy cartilage and collagen protein. Now, one more example is if you extract type 2 cartilage protein of the mice origin and inject into mice, okay, by artificially modifying it, type 2 cartilage protein, and then modified by few amino acids, that is by oxidation or reduction of those amino acids in the laboratory condition, and then inject back into the mice, and mice will develop arthritis. So that proves the fact that arthritis is confined to the cartilage as well as the collagen proteins that are associated with the cartilage, which is destroyed, and some of the microorganisms which have shared epitopes could initiate that reaction. Then coming to the example, systemic lupus erythematosus. I had mentioned that type C retrovirus, when infects the person, type C retrovirus infection takes place in a person. He may be cured later with the antiretroviral therapy and etc., but may later suffer from systemic lupus erythematosus. Even though he's going to be vaccinated or going to be protected against type C retroviral infection later, the person may suffer from an autoimmune disorder of systemic lupus erythematosus. I've told you that here large number of different types of cells are going to be destroyed because of the shared antigenic epitopes of type C retrovirus, which is going to be present on our cells, and that will be destroyed. Similarly, it may even cause hemolysis because I had said that in systemic lupus erythematosus, RBCs are also destroyed. It may cross react with the nuclear proteins and destroy the DNA. So this is observed, and we are not sure still. We are still trying to understand coronavirus, and there are still more, very little known about it. Still more work is needed, and many more years of work will be done on coronavirus from henceforth. And you may come across, because it is a retrovirus, coronavirus is a retrovirus, there is a possibility that it is already causing several different types of damages in the body. It is possible that this virus also may be responsible for some kind of an autoimmune response once the person recovers from the disease. because of the shared antigen of the virus with the shared epitopes present on the cells. We don't know, and future will come to know. Then induction of multiple sclerosis. It can be induced in mice by injecting myelin basic protein. Simple myelin basic protein injection will result in multiple sclerosis in mice, where it will start losing the myelin sheath on its nervous system and becomes totally immobile. It cannot be moving about in its cage. It was also observed this multiple sclerosis symptom in people when rabies vaccination used to be given to people earlier, not now, earlier, many years back, that is before 1980s. 1980s, whenever the people were administered rabies vaccine, that rabies vaccine used to be prepared in the brain of the sheep. The live sheep used to be injected with rabies virus. Okay, and that rabies virus used to grow in the cerebrospinal fluid of the sheep, because virus has its target the central nervous system, and it grows very well in the cerebrospinal fluid, in the brain vesicles as well as the spinal cord central canal. So harvest the virus after growing in sheep and use that as a vaccine. Why? Because sheep is a non-host species and sheep will never develop rabies symptoms. So the rabies virus grown in sheep, and I had given you this example, non-permissible host and permissible host, when I dealt with acquired immune response. Okay, the artificially acquired immune response where active immune response with vaccination, I had dealt with this example. Non-permissive host, when you grow the virus in non-permissive host, the virus will lose its virulence. So rabies virus loses its virulence when it is grown for several generations in the sheep, and that used to be harvested. And harvested rabies virus from the sheep brain used to be given as a vaccine to the people. And this was developed by Louis Pasteur. Okay, this vaccine was developed by Louis Pasteur. It was working at that time, it used to work, it was working up to 1980s, but then people who recovered from the disease after the vaccination used to develop kind of multiple sclerosis like of symptom, and that is called as encephalomyelitis. And this example where I'm talking about injection of myelin basic protein into the mice, it is also called as experimental autoimmune encephalomyelitis. In short form, it is called as EAE, experimental autoimmune encephalomyelitis. And that type of encephalomyelitis used to be felt by the people who were given rabies vaccine earlier. And that vaccine was prepared in sheep brain. Probably some amount the myelin basic protein used to come as a contaminant in the viral preparation of the vaccine, and that would trigger the antibody production in addition to the rabies virus antibody, and that antibody used to destroy the myelin sheath of the people who were vaccinated. Now that practice is stopped because genetic engineering has brought in subunit vaccine process through cell culture method, where rabies subunits are used, virus subunits are used to be produced as vaccine subunits, and that is being practiced now all over the world. Therefore, encephalomyelitis is not experienced by the people who recover from rabies, rabid dog bite or rabies infection. Okay, that is as far as the experimental models for the autoimmune disorder is concerned. Now I'll just talk about the therapies for the autoimmune disorder. Okay, the therapies are as follows, like immunosuppressive therapy, plasmapheresis, thymectomy, and T cell vaccination, and monoclonal antibodies against different receptors of the immune cells, and anti-inflammatory cytokines. The T-cell vaccination and monoclonal antibody therapy and anti-inflammatory cytokine therapy came into existence once the genetic engineering evolved and monoclonal antibody therapy evolved. Until then, this therapy was not available, which I should say up to like 2000, these therapies were not available. Only the therapies that were there was immunosuppressive therapy, plasmapheresis, and thymectomy. So immunosuppressive therapy, which is common, it is the same therapy that is used even for the cancer treatment. It is the same therapy that is used when the graft, that is tissue graft, is done. Immunosuppressive therapy. There are no separate different types of immunosuppressive therapies for grafts, that is transplants, organ transplantation, for the cancer treatment, and the autoimmune response. The immunotherapy, suppressive therapy is the same. The reason being, the drugs that are designed, to act are meant for replicative stage of the cells, to interfere with the DNA replication, okay, DNA replication, or to prevent the cells from proliferating, okay. That is, at the DNA replication stage, if it is in, cells will stop proliferating. Remember, when we were talking about the activation of T cells, activation of B cells, okay, activation of T cells and B cells both will involve, once they are committed to a particular antigen, they are supposed to undergo proliferation. Clonal proliferation means the clones of T cells, clones of B cells meant for that antigen are going to be produced in large numbers, in millions. And that proliferation should be prevented from happening so that the immune response is suppressed. Now, tell me, when the immunosuppressive therapy is developed against proliferating cells, until and unless you target the drug to that particular cell, it is going to be systemic. Okay, it is going to be systemic means it will act on all the cells that are dividing in your body. Let us presume that the immunosuppressive therapy is given for an autoimmune patient to prevent his T cells from proliferating, which are now developing autoimmune response. Similarly, B cells from proliferating, which are developing auto antibodies. And that is T cell dependent B cell response. Now you have to prevent both these cells. If you are doing that and administering an immunosuppressive drug, it will not be selectively going to prevent T cells and B cells from proliferation. It will prevent intestinal cells also from proliferating, because every day in your life, the intestinal cells also proliferate to rejuvenate the epithelium that is lost as an aggression against the food that is passing through your intestine. A new layer of epithelium is going to be formed due to proliferation. There are stem cells in the intestine that keep giving new cells to replace the dead cells. And that process is normal, which is going on every day in your lifetime. And that also will be prevented if immunosuppressive therapy is given. Same time, bone marrow is a proliferating tissue 24/7, 365 days. There is no time that bone marrow is quiet. It cannot be quiet because your immune response is an active process. And bone marrow is required for various different things like hematopoiesis, that is your RBCs, as well as leukopoiesis, that is your WBCs. These are being continuously produced 24/7, 365 days. And that bone marrow should show proliferation for this process. And imagine, and immunotherapy is done, the bone marrow gets suppressed. That will result in systemic suppression of the autoimmune response. All immune response of the person is suppressed. And that is called as immunocompromised person. Person is compromised. There is no immunity in him. He will be vulnerable for all types of bacterial and viral infections. He has to be protected. Remember, you might have seen cancer patients. The cancer patients will be wearing the mask, and they will wear the mask, and they will be moving about with the suppressed immune response, and they're highly vulnerable for all types of bacterial and viral infection. So immunosuppression, if it is not done target oriented immunosuppression, then it is very, very bad for the person. So details about different types of drugs that are used for immunosuppression, I'll be talking about that in unit 5 in both cancer therapy as well as in transplantation immunology. In transplantation immunology, we have to talk about those immunosuppressive drugs. For the time being, keep in mind the immunosuppressive drugs are dangerous. Now, the monoclonal antibody therapies are available, which are going to be tagged or conjugated with the immunosuppressive drug, which will deliver the drug only to the specific area or to the specific cell and make that cell die. And target oriented therapies are followed nowadays to prevent systemic suppression of the immune response and other side effects of the immunosuppressive drugs. And thank you very much